Welcome to the United Kingdom, home to an automotive industry making cars for over 100 markets, and where some of the world's biggest movies are created. Welcome to the first testbed for 5G technologies, and where top pharmaceutical companies find their talent. Welcome to the largest offshore wind farms in the world. Welcome to a land alive with opportunity.
Welcome, everyone. Welcome for this prize. I hope everyone are having a very nice day today. For who doesn't know me, my name is Bruno Pina. I am the Chief Digital Officer of Astrazeneca in Brazil, and I have been invited for this amazing event. Also, I'd like to thank everyone who have been submitting your startup, your pitch. We're very excited to have you all here. And I'm very excited to, give you this offering for interrelationship between Brazil and United Kingdom. For those who don't know about the UK market, we look for Brazil health tech, for example, we have more than 600. If you look for Distrito last health tech radar, if you look for England and for UK, we have more than 3,000 startups, especially for healthcare startups, and big names, big amazing names today, like Babylon, like Pharmacy2U, like Benevolent AI, like Sierra, like Lumion. So amazing startups today doing a difference. Also a very nice difference in Brazil. Yet we don't have what we call in the startup ecosystem. We don't have a unicorn. But UK, yes, we have. So I think it's a very interesting opportunity to exchange information, to exchange knowledge, and definitely to get to know the countries and the difference between what we can do in Brazil that we can learn from UK and vice versa. With that, I would like to invite Martin Wele, the director for the Department of International Trade in Brazil, to do the opening of this event for you.
Brilliant. Thank you, Bruno. Good to be here. Thanks for the introduction. So as you say, I'm Martin. I'm the Director of Trade and Investment at the British Consulate here in Sao Paulo, where I am at the moment. And yeah, great to have you here, Bruno. Thank you for joining us. Good. AstraZeneca are good friends of ours here in Brazil. And obviously, recently, we've been working even more closely to you. So thank you for joining us. Great. So firstly, let me congratulate all of the companies who are going to pitch to us today, but not only those companies. Let me also congratulate those companies who applied to this competition, because we've been through a process, a very competitive process, to narrow down from over 30 companies who applied to this competition when it first opened, to have now 7 companies who will pitch to us today. So well done to those 7. Well done to those over 30 companies who applied first up, and to those 7 for making it to this final. And it's really exciting to see so many Brazilian companies with such brilliant solutions to problems in primary care, and to see what's been developed here in Brazil. And also really exciting to know that these companies are keen to work with us in the UK. We are keen to work with Brazil. We already do work with Brazil. And the more we can do between the UK and Brazil, I think the better for this sector. So thank you for your interest, and looking forward to ensuring the relationship between the UK and Brazil is even closer in the future. So a reminder, the focus of the competition today is to identify innovation that enables a personalized approach in primary care. These solutions will support prevention, diagnosis, and disease management, which of course provides lots of benefits to the patient. And the winner of this competition will receive a visit to the UK, where they will get the opportunity to attend workshops with leaders in the UK medtech sector, including partners of ours such as UCL and Medilink. In addition to that, you will also be able to count on the guidance of those partners, but also us, the team here at the British Consulate in Sao Paulo, supported by our team back in London, who are set up to really help companies consider how and where and what they need to do in order to go international and to start serving the international market. So the competition today is a pitch. Shortly, we'll hear from our companies. I just want to quickly mention the evaluation criteria for these pitches. There's 4. First up is the relevance and innovation of the solution to the primary care sector. Second is the maturity stage and market feasibility. The third criteria is the product fit into the international market. And fourth, we'll be looking at the presentation as well and the communication skills and development skills of the entrepreneur and the company. So why should Brazilian medtech companies care about the UK? Well, firstly, the UK is one of the world's strongest and most productive life science sectors in anywhere in the world. It has a really high concentration of talent, and there's lots of innovation going on there. We know those things are also here too in Brazil, lots of talent, lots of innovation. So what we're keen to do is to bring our 2 countries more closely together. Also, the life sciences sector in the UK is already Europe's #1 location for inward investment. Lots of international companies from around the world invest into the UK and decide that their home or their second home beyond their home country should be the UK. Thirdly, we have a team of dedicated professionals, and thanks to the team who set this up, including Daniela, Cristiano, and Julia, who are based in Sao Paulo and are ready to help Brazilian companies with the process of going international and setting up in the UK, so you can count on them. And just to give you an example, at the British Consulate over this last year, we've helped 3 Brazilian companies in this sector to go to the UK and to establish their UK presence this year, including Jade Autism, Cor.Natural, and EpHealth Pharma. So well done to those companies for doing that, and well done to our team for helping that happen. And this moment of global crisis obviously really underlines why we are so focused on medtech, why we are so focused on bringing better solutions to patients in the UK, in Brazil, and around the world. It also shows how important global cooperation is to combat COVID-19. It couldn't be done by any one country by itself. And a great example of that global cooperation is actually the Oxford Astrazeneca vaccine. It has a couple of different names, but the Oxford Astrazeneca vaccine, which is being used in the UK, being used in Brazil, and is the product of Astrazeneca and Oxford University, but produced using scientists and doctors from around the world and manufactured all over the world. So this is not a British success, it's not a Brazilian success, it's a global success. So well done to everybody who's been involved in that. And the UK is committed to invest in this sector. I mean, this competition is an example of that. There's lots of investment going into medtech in the UK. So just leaves me to say, before I pass back to Bruno, just some thanks. So this competition was a joint effort from lots of people. So thank you firstly to the team within the British Consulate here in Sao Paulo and in London who set this up and arranged this. We couldn't have done it though without more partners, including Innova, HC, and Distrito, Medilink, NICE, UCL partners, and most importantly, all of the companies that applied to this process, including those who didn't make it to this pitch day today. Finally, thanks to our judges. We have 3 judges with us today. They'll introduce themselves shortly. They are Maria, Marco, and Neville. Thank you guys for judging us today and adding your insights and your views. And finally, of course, thanks to our Master of Ceremonies, Bruno Pina from AstraZeneca. Great. Good luck all. Looking forward to seeing the pictures. Bye for now. Back to you, Bruno. Sorry.
Thank you, Martin. And with that, I would like you, Martin, thank you. Invite our judges to the stage, Nev, Maria, and Marco Bego, and I will let you guys please introduce yourself for the people here, and then after that I will explain a little bit how it's going to be the dynamics of the pitch. So starting from Maria, please, ladies first.
Hi there. Can you hear me okay?
Yes.
Brilliant. Hi, my name is Maria Kyriakou. I'm from the NIA. The Innovation Accelerator is an award-winning NHS England initiative, and it supports the delivery of the NHS long-term plan priorities. It accelerates uptake of high-impact innovations for the patients, population of NHS staff, and it provides practical insights to spread to inform national strategy. It was launched in 2015. The NIA is chaired by Professor Stephen Powis, the National Medical Director of NHS England and Improvement, and it's delivered in partnership with the 15 academic health science networks and hosted at UCL partners. It places a dual focus on both the innovator and the innovation itself. Thank you for inviting me today, and I'm excited to be part of the panel.
Thank you so much, Maria. I think everyone will learn a bunch from. I love the NHS versus the public health system in Brazil, SUS. It's very similar in some things, but we have much to learn. So with that, I would like to invite Nev, please, to present yourself for the audience.
Good afternoon or good morning, everyone. Thanks for joining the call. Thanks for the invite to take part, Bruno and the DIT team and everybody involved. It's great to be here. I work for an organization called an Academic Health Science Network. And unfortunately, you're probably going to get quite a few acronyms today on this call. But part of my role is, and the role of my organization is to help you understand what's going on in the UK market, what all the different pieces are, how they fit together, and how we can help direct you around that space. The Academic Health Science Network, or the AHSN, we are funded in a really interesting way. We have funding from the NHS that comes with a commitment to deliver health efficiencies in the UK, working in partnership with industry. And part of our funding is from the Office of Life Sciences, which is the business side of government in the UK. And that means we've got two objectives. One is around economic growth, seeking and securing investment, creating high-value jobs, and the other is about delivering healthcare efficiencies and improvement. So we are very keen to talk to innovators who have got really good innovations and helping to shape your offer to the UK market. The UK market is different from your market, and every market you go into is going to be different. And we're here and we're set up by the government really to help you navigate those challenges in that market. And if you come to the UK, I'd really encourage you to reach out to an AHSN somewhere in the network. I'm very happy to be that first point of contact and help triage you to the right places. The UK is much bigger than London. I would recommend you come to Yorkshire in the north of England, in fact. But I'm slightly biased in that, but you're very welcome. And I think when you come to an HSN, we will challenge you about your innovation in a constructive way, in a way that helps you shape your value proposition for the UK market. And it's really important that you build on the similarities in your own health system in Brazil and bring what works well there to the UK market, and we will help you shape your offer. We will talk to you about the 3 Ps. Your value proposition has to fit for patients, it has to fit for payers, and it has to fit for the providers. And we'll help you shape that proposition to meet those 3 Ps. And that's all about the 3 Rs. And that's sort of about relationships, relationships, and relationships. And we will help you build those relationships. That will help you overcome hurdles around regulation, information governance, the NHS alphabet soup. That's what we're here to do. So I'd really encourage you when you get to the UK, whoever the winner is today, come to Yorkshire, come and speak to us in our patch as well. It'll be easy to do over Zoom, but there's opportunity across the entirety of the UK, and the AHSN network is very much interested in helping you navigate that journey. So well done for getting this far. It's great to be part of this. I think this is the 3rd or 4th one I've done since Christmas. I've done Norway, America, Israel, and now Brazil, and it's great. We've had some success stories from all those places. So we'd be very happy to have you on board with some more success in the UK market. Thank you.
Thank you, Nev. I think it was amazing what you said. For Brazilian, this is an amazing opportunity to exchange. I love the 3 Ps, but I love more the 3 Rs. I think all the startups, all the people need to understand that inside this new ecosystem world, everything is about relationship, about getting connected, and about being relevant for your persona, who you are serving for. Of course, you have patients at the end, but in the middle of this chain, of course, the providers and the payers will be there, and we need to be available for all of them. So thank you so much. With that, I would like to invite Marco Bego, our Brazilian representative here today. Marco, please.
Thank you, Bruno. Firstly, I'd like to thank Martin and Danilo Santos for the invitation, and Daniela that helped me with the information before this meeting. and greet my colleagues here, Maria and Nev. I would also to thank the British Consulate that for the partnership with the Hospital das Clínicas, HC, and currently our main project here in digital health has the support of the British Consulate and the NHS, is the Better Health, the program with the NHS, British Consulate, and Brazilian Ministry of Healthcare. And the project is so important for us. That's my thanks. I am an executive director of Inova HC, which is the innovation program at the Hospital das Clínicas of the Medical School of the University of São Paulo. Hospital das Clínicas is the largest complex hospital in Latin America. And the Inova HC was built for the development of an innovation ecosystem in health, connecting person and companies, government and universities. That's our idea here. It is an open innovation program, which runs the innovation from outside to inside and vice versa, to the Hospital das Clínicas and the University of São Paulo. We focus on using innovation to solve complex problems in healthcare and transfer technology, scientific knowledge, and cultural knowledge from the society. Prizes like the Medtech Awards indicates that our ecosystem is working, and the startups is growing. And for this, I congratulate all the organization of the prize. And to finish, I wish luck and success for all the startups that arrive at this final. I think the journey is not easy, and go. Thank you.
Thank you so much, Marco. So for those who don't know as well, also Hospital das Clínicas is the biggest public environment ecosystem in Latin America. So more than 20,000 HCPs working day by day, saving lives and helping the ecosystem to become better. So thank you so much, Marco. With that, let's start our session today. So just to explain a little bit how it's going to be the dynamic, I think most of you, the startups, have received the information, but we are going to have 4 minutes pitch and then 4 minutes question from the judge per startup, okay? Of course, we will be very strict with the time in the 4 minutes. So to be not impolite, when we have the 4 minutes coming, I will appear in the screen so I can let you guys know that we are going to the end, probably 10 seconds before, so you know that your time is getting over. Okay. After that, let's move. We have a lot of companies being presented today. Amazing companies. I saw the list. I know some of the CEOs of these startups, so I'm very proud to see these guys here today. Some of them I have interacted, some of them I have worked with. So very nice. And then the judge will be evaluating the pitch using that 4 criteria that Martin presented around relevance, maturity, product fit, and also the presentation of the pitch. So with that, let's start. I would like to invite here for the stage the company called Cor.Sync. I also know the CEO and the company. I think I thought the company growing. So please, Cor.Sync, be here with us. Welcome. And when you can, hi Raul, good to see you here, my friend.
Hi Bruno, very glad to see you again. Thank you very much for having me.
Yeah, no, congratulations for being here in the final pitch. So you have 4 minutes from where we start, okay? Thank you and good luck.
Thank you very much. Well, just waiting for my screen to be shared, and then I'll start. Right. All right, so hello, my name is Raul, and I am the founder and CEO of Cor.Sync, a Brazilian startup with a solution for fast and accurate infarction diagnosis. Also known as heart attack, infarction is one of the deadliest diseases in the world. And trying to avoid these deaths, many hospitals treat healthy patients, generating unnecessary costs by false positives. But much worse are the false negatives, because most infarctions have no ECG changes, and often the patients are discharged by mistake. Diagnosis based only on the electrocardiogram alone is not enough. For a reliable diagnosis, along with the ECG, a troponin blood test is necessary, but it takes a lot of time and on a traditional laboratory. And we are talking about more than 1 hour. The consequence is that half of the deaths by infarction happen inside hospitals. But then, how can we save more lives? To address this problem, Cor.Sync created a point-of-care device that provides high-sensitivity troponin results in less than 10 minutes. This is made possible by a proprietary method that is performed at the emergency room by the clinical team, because it requires no sample preparation or confirmation by the lab test. The test is quick and easy. The blood sample is collected and inserted into our consumable. Then, it is inserted into the device that performs an automated test. After 8 minutes, the quantitative results that physicians need to save lives is shown in the device screen. It can also be shown on the computer screen and uploaded to a cloud database. And with little more information and a machine learning algorithm, we provide an intuitive dashboard to support clinical decision. So we can deliver value for patients and healthcare systems, making the patient journey simpler and helping hospitals to be more efficient, saving time and money. Our business model is also innovative. The device has no cost for the hospital that pays only for one consumable per test and a monthly subscription fee. They are priced accordingly with the hospital consumption, making it an affordable solution. There are big companies trying to address the same problem, but all of them have high error levels and can only be used for triage, demanding a lab test for diagnosis confirmation. So Cor.Sync has the same accuracy and is much faster than laboratories, but it also stands out in relation to other point-of-care devices, providing the fastest and most accurate test, being the only one that can be used for diagnosis. So we are saving time to save lives. And it all began with my master's degree research in biomedical engineering. And since then, we've won the support of reference partners, including Imperial College of London, along with 1 million in government grants in Brazil, and many national and international awards. We are now under clinical trial at Albert Einstein Hospital with many other reference institutions waiting for a solution to be available in the market. And the sales here in Brazil will start this year, as well as the UK clinical trials, so we can deliver it to UK and Europe next year. And together with British and Brazilian institutions, we are developing new tests for our systems, making our device a tabletop laboratory to address fast diagnosis for the most critical diseases. Behind this, there are 4 founders with strong academic and industry background, and a multidisciplinary and qualified dev team, but above all, people who wants to save other people's lives, because this is our mission. Thank you very much.
Thanks. Thank you so much, Raul. It's right in time, and congratulations for time management. We know that it's very hard sometimes to manage the time. With that, I would like to invite back to the stage all the 3 judges to have the 4-minute session for questions. Okay, whenever you want. Go ahead, Nev.
Okay, Raul, thanks for that. That was really interesting. How do you see this product evolving in a market where there's quite a lot of competition already, even if you can demonstrate higher sensitivity, specificity, and better cost? What's your strategy to break the monopolies?
Well, thank you very much, Nev, for the question. This is a very good question indeed. We have a strategy to partnership with reference hospitals and universities around the world. And by this, we can show that it's not just another point of care. It's the most accurate one, and it's really suitable to diagnosis. And this is something that no one is doing right now. Everyone sees point of care devices as a triage device. And it doesn't need to be true. We can change this. So this is our strategy, to deliver diagnosis, not only triage and in partnership with big partners.
Thank you.
Thank you.
Anyone else? Marco, Nev, Maria? Yes, please.
So can you tell us a bit about your implementation? So where have you, in what sites and what countries have you implemented your product, and what's the feedback been?
Nice. Thank you for the question, Maria. So we are now only in Brazil under clinical trial. So the feedback is very good because our product is running in one of the most famous hospitals here and one of the biggest ones. Not as big as Hospital das Clínicas, but it's a big one, Albert Einstein, and they are referencing everything. And they are really giving us very good feedback. So it's been a very interesting thing. And in UK should be our second home. So we're in Brazil and we want to be in UK as soon as possible.
Okay, Lambert. Raul, I think you have a plus in your product, because here in Brazil the ER is the biggest entrance from the hospitals. The patients come from ER for all of things and all of disease and all of symptoms. But you are in the good hospital in Brazil, I think the best ones. And how they tell you about they put this test inside the protocols, the infarction or stroke protocols, because these protocols are for a long time and they are very established in this hospital.
Perfect. Thank you very much. This is a very, very interesting question, Marco. So I have a partner, a co-founder that is a cardiologist, and he is writing a new protocol to help hospitals to upgrade their protocol. So we are acting as a consultancy to help hospitals to improve their protocols in CVD. So we want not only to deliver this solution, but also help hospitals to evolve, to upgrade their protocols. And it's a very important thing, because a good device inside an old protocol will do little, and it's not enough. So we are acting like consultancies to help hospitals also, and it needs to come from a medical doctor that is Atilio, our co-founder and cardiologist.
Thank you. Congratulations.
Thank you, Raul. We got to the end of the question session. Nev, if you have one more question, please.
Yes, please. Yes, please. So the data that you collect, is your innovation able to integrate with established healthcare record providers, EPR, Cerner, Lorenzo, things like that? How will we get the data into the patient's healthcare record?
Perfect. Thanks for the question again. So this is already in development. We are integrating it with Tazi from Siemens and also from Philips, sorry, and also MV. They are the two biggest ones here in Brazil, and we will have other ERPs coming through in the next year. So this is one thing that we are already working in with APIs to integrate database, and it's on course.
Thank you, Raul. Yeah, there's a challenge for other companies when you look for the Brazilian ecosystem and how the systems are very fragmented. API robust solutions will be like API first solutions, because if not, you have a problem to integrate. So thank you all the judges for the questions. Raul, congratulations. I love your startup. So thank you for having and all of this engagement and the team, what you are guys doing. So thank you. With that, I would like to ask for the next startup to come here. So the next one is Brava. So Brava, please, if you want, and if the guys from Brava are already here, you can bring them to the screen. We have Marcus here. Hi, Marcus. Nice to meet you.
Nice to meet you too. Thank you. Good morning, everyone. My screen is showing up.
Not yet. Let's wait for that. And then after you start, I will start counting 4 minutes. Thank you so much.
Okay. Well, I think that the screen is okay. I'm sharing it. Well, my name is Marcos. I'm the CEO of Brava. Brava is a health tech startup that's focused in the prevention and early diagnosis of breast cancer. Our company started with a simple realization. If there is a war worth fighting, it's the war against health and disease. But pretty soon we realized that even in defense of health, wars are costly, inefficient, and risky, especially against a powerful challenger like breast cancer. That's our first chosen enemy. Humanity has learned that better than win wars is to enter one, as not to enter one, and develop diplomacy to prevent costly fights. So we ask ourselves how we can contribute to prevention and early diagnosis of breast cancer so they can be as efficient and instrumental as diplomacy. According to the scientific literature, breast cancer incidence can be reduced by up to 30% with preventive measures, and mortality could be reduced by 95% with effective and early diagnosis, with the synergistic actions between the two. If you take into account the exponential costs of breast cancer disease progression over the stages of the disease, this is a gigantic number. But like in diplomacy, prevention and early diagnosis should be active, cost-effective, and heavily guided by data and intelligence, without leaving out one important factor, the human factor. We need to also, together with the physics aspects of the disease, also treat and work with the psychological aspects of the patient. So Virda is a digital health platform that we developed to integrate an array of interdisciplinary technologies from genomics to telemedicine with the purpose to form a coherent process for effective breast cancer prevention and early diagnosis. This is accomplished by building an accurate genetic, environmental, behavioral, and clinical risk profile over a journey that the patient runs across by steps of self-discovery, understanding, motivation, and action materialized in a personalized breast cancer prevention and early diagnosis program. To abstract that concept, we envision Virda like a machine that takes a women population as input from a city, from a state, or even for a country, or specifically like a company or insurance plan. Then, guided by scientific, ethical, and cost-effectiveness criteria, we select the most at-risk individuals and guide them through a set of personalized risk-reducing actions and output lowered risk Virdas, like a call, women that are self-conscious about their risks and the actions that are needed to reduce them, and the tools to successfully complete the personal breast cancer prevention journey. This journey is tracked by a specialist team of physicians or internal team of physicians with the aid of telemedicine and data science, providing specialized orientation for each Virda case. But like in diplomacy, prevention and early diagnosis should be vigilant and not a one-time event. Virda is designed to keep the user connected and engaged by offering additional services and tools, like nutrition specialists for women where body mass index is the most at-risk criteria, or genetic counselors when the most important factor of risk is genetic. Then we personalize that journal for each person inside this machine. The platform also hosts a social community, a specialized support system, and digital tools for annual screening tests and additional physician consultation and specialized partnerships. Being a platform, Virda can adapt to new technologies and to new continuous advancing of science, always incorporating the best practices for cost-effective prevention and early diagnosis of breast cancer. Our goal is to abstract all the technical and operational complexities involved in the procedures that are needed for personalized disease prevention with convenience, and for our Virda clients, and also for, in the future, physicians that can use that tool as a clinical tool, and a continuous development of the precise breast cancer prediction and prognosis models. Our product is already in a first commercial run. We had already
Marcus,
yeah.
Sorry, you are up on your time. Sorry for interrupting you in the 4 minutes. I will let the judges enter with us here, and so if they can ask you about the finish of your pitch, they can. But I will let them start asking the questions Okay, sorry.
No problem.
Go ahead, Nev, please. Thank you.
So Marcus, thanks for that. I just want to understand, do you expect this product to result in a healthcare system investing time and money into treating people who are not yet ill?
Yeah, but the system has a system that do a pre-screening for people that most benefit for this kind of technology. We do not screen, we do not do any kind of actions to young human, for example, because they don't need that. But we have a pre-screening tool that identifies through a set of questions which woman will benefit the most for this kind of
I get that. I get that. I guess what I'm asking is, how will we know that it works whenever you're stopping something from happening, and how can we put some cost and value to the system? Have you thought about that?
Yeah, because when you see the statistics about how costly breast cancer is in a population, when you compare a stage 1 breast cancer treatment with a stage 3 cancer treatment, and you see the curve of costs that happen between one stage and the other, and you factor the number of cases of breast cancer happening in some population, you can identify the costs that this service provides and the value that this service provides against that cost that happens in the whole population as a solid one. Then when you factor that questions, you see that even a small efficient, in part by prevention, could reduce significantly the cost of the total population lives.
Thank you.
Yes, please, Maria. Thanks.
Hi there. Just building on what Nev said, it would be really helpful to formulate a statistical case that could back that up. So if you're able to talk about it theoretically, it'll be quite helpful to talk about how many extra cases you may end up diagnosing, and for those extra cases, the avoided treatment that would have happened as a consequence. So the British system will always think about what have I saved by doing this? I've avoided this, and this. So that this is commentary, perhaps just for the UK system, but it's about being able to quantify if I caught this, if I diagnosed this earlier, or at the stage 1, then I've avoided treatment at stage 3. So being able to quantify it. And it might not, so I get that the costs will be different in each country, but if you can just articulate that and the volumes of people that you might diagnose at an earlier stage, it's turning the theory into some kind of statistics or numbers, and it might be that you can only bring values to the Brazil system and in time to the UK system, but to make it more tangible for the people reading the business case. But it sounds very strong.
Yeah, well, one thing that we observed with the early tests that we've done with the platform is that there's some kind of cognitive dissonance about the potential of breast cancer prevention against the woman population here. And in the first iteration of the product, we don't intend to diagnose people early, but to drive these people into an education platform, drive it by the self-discovery of the risks, voluntary discovery of the risks, to identify the women that are in the area under the curve of risk that can be most benefited by this kind of machine that can identify and provide intelligence about what is the best actions for that case. And the kind of tests that we use for prediction and prognosis could identify and help to identify women that can benefit for example, early breast cancer screening. Because many the recent discoveries in genetics can show us that many women that started this screening later in life could have benefit in screening in a young time. And our objective is really identify these women that could benefit from this kind of information and the support that the medical team can do to them, and and help them to achieve that journey of health style and better management of their risk through their life.
Thank you, Marcus. We are out of time, but any other questions from the judge?
That's okay.
No? Okay. Thank you so much. Marcus, thank you.
Thank you.
With that, I would like to invite the next startup that will join us. They're going to be the Hilab. Hilab is in the category of early detection and accelerated diagnosis. Hi, Marcus. Nice to meet you.
Hi, Bruno. Glad to meet you too.
Great. So if you want to start sharing your presentation, and after we start talking, I will count the 4 minutes you have, okay?
Okay, perfect. Okay.
Thank you.
Thank you. Hi, everybody. My name is Marcos Cigarido. I am the CEO and founder of Hilab. I founded the company in 2016 together with Sergio Rogal. We are both computer engineers with backgrounds in artificial intelligence applied to healthcare. And we have been working together for the last 16 years. Hilab is our third creation, is the third company that we create in health tech space. And we are Endeavor entrepreneurs since 2017. For this project, we brought more than 250 other hires to help us to build the smallest lab in the world. So they came from company, from the industry and from the academy. And also we already raised 3 investment rounds with 5 top VCs from Brazil and the United States. Hilab can be understood as a lab over the internet. We use Internet of Things, machine learning, and big data to perform lab tests in less than 15 minutes. The idea is quite simple. The technology is a little more complex. So basically, you collect 1 drop of blood from patient's finger, or maybe a nasal swab from the patient, depending on the kind of test you want to do. You put the sample inside one of our disposable capsules, and you put the capsule inside the device. A chemical reaction happens inside the capsule. The device reads it and sends to the internet. In the internet, we have artificial intelligence software that analyzes that in real time. And we keep a team of medical experts that analyze each result. So in 15 minutes, the patient receives by email and by smartphone a lab report with the result and all the information the patient needs to know about his or her health. So the user experience, the patient experience that usually would take days or maybe weeks in a traditional lab, it takes less than 15 minutes with the same accuracy and quality control of a traditional lab. The same hardware can perform different kinds of exams. User just needs to change the capsules. So we are talking more or less about an espresso for lab tests. We can do tests for different kinds of disease. Right now, we have more than 40 different kinds of tests running in Brazil for chronic diseases, infectious diseases, complete blood count, genetic tests, drugs, and a lot of others. The most famous test we have here in Brazil right now, it's the molecular test, the PCR for COVID-19. We have more than 1,600 clients in different segments. For example, the 9 largest pharmacy chains in Brazil are our clients. We have companies, we have clinics, labs, healthcare plans, and we are already in the public service in more than 300 cities in Brazil. Our footprint reaches now almost 1,000 cities in the country, so we are talking about all Brazil, to be honest. So we have up to 10,000 devices right now. About 50% of Brazilian population lives near to a Hilab. I'm talking less than 2 miles. So we are talking about more than 100 million patients. And right now, we already have signed contracts with 2 countries overseas. We have a very clear value proposition. We offer experience for the patient. So we are painless, we are fast, and more important, we are accessible. For healthcare providers, we offer turnkey solution. You can set up a Hilab anywhere. And for payers, we offer data governance for healthcare plans, for companies, and most important, for the public service. All results are sent to the cloud, and we have anonymized epidemiological database that allows us to do a lot of things like contact tracing, epidemiological surveillance. We can help provide the intel for vaccination, for lockdown, for several of strategies. We're already doing that in Brazil right now.
Marcus, sorry to interrupt you.
No problem.
Your time is up. I never like this position of interrupting your pitch.
No.
It was amazing work just presenting what you were doing in the COVID. So thank you. With that, let me invite the judge to start asking you questions about your pitch and about your solution. Congratulations.
Perfect.
And please judge, just raise your hand and start talking.
Can I start with Bruno?
Yes.
Marcus, congratulations for the presentation. Just for understand well, our business model is this device is inside the pharmacies and the clinics, for example. The patients or the clients need to go there to collect the blood. That's the idea.
Yes, actually, we are now in pharmacies, in hospitals, in medical offices, in public healthcare units. So patients go anywhere. They are already having a healthcare assistance, and they just do the test there, and they receive the result in 15 minutes with the healthcare professional together. So basically, we are talking about a point-of-care technology service replacing a traditional lab.
And in a final question. When the patient receives the information and the results of the test, because the normal way you receive the result of the test, but you can understand that you need a physician to understand. In your report, you just have a physician analysis, or you need just the result of the exams?
The report has the result and a lot of explanations about the test, explaining to the patient. But usually the patient has the physician together with him when he receives the test, because it's just in the moment of the medical consultation. So you can just read the result, but you always have or the pharmacist or the healthcare professional or the physician together with you in the moment.
Thank you.
Marcus, great presentation. Feels like you guys don't need much support. You're not a startup anymore, are you? It kind of feels like it's market entry support that you're after into our market. I think that's fine, absolutely fine. I think you're going to have some challenges in this market around the payers and the providers. So who pays for the test, who uses it, and who analyzes the results. But yeah, really interesting space. I think this keeps people out of hospitals as well. So very COVID, friendly. This reaches patients in areas where it's traditionally we struggle to reach them. So it deals with some health inequalities issues. So that was a good pitch. But I think it's market entry support that you're after, not innovation support. So really interesting.
Thank you, Nav. We are in a moment right now that in Brazil, we did more than 3.5 million tests for different kinds of diseases. But our next challenge is how we become international. So we already signed some contracts with some countries, but we really want to test our technology and our services in a more mature health system like UK's. We are trying to create a democratic lab. So the idea is to have patients in Amazonia, in Rocinha, that's the most famous favela in Brazil, but also in a great country as UK, all patients using the same technology, the same kind of test. Yes.
And what's your regulatory challenge when you come to this market in Europe and in the UK in particular? How are you FDA or CE marked? Where are you with that?
We already have the FDA clearance for the device, and right now we are getting the CE marks because I think next month we will start doing tests in Portugal.
Yeah. It's going to be very complicated in Europe at the moment with Brexit and the UK. So if you come to the UK, ask the right questions about this. They're effectively two different markets now as well. So CE mark is good for now, but things will probably change over the next 12 to 18 months, and we can put you in the right direction.
Perfect. That's what we are looking for.
So we have time for one more question. If any of the judge wants, Maria or Marco, someone wants. Okay.
Just a small point. It sounds like a fabulous product. As in the UK market, some of the systems are now talking about how they provide care outside of a hospital in people's homes. So I don't know the cost of the product, but there'll be people with long-term conditions. COVID has taught everyone that you don't have to be in a hospital all the time. So for asthma and COPD and some of those other long-term conditions, is it financially viable to have one of these machines in someone's home to support them with their self-care? I don't know what the answer is, but that will be, I think, an increasing market in the UK in the years to come.
Oh, actually, when we designed the product, our first idea was to put the device at the patient's home. But here in Brazil, we didn't have the market in 2017. That's the reason why we went to pharmacies, hospitals, and medical offices. But the technology was designed thinking about the patient testing themselves at home. It works this way. We just don't do that here because of the market. But talking about economic feasibility, yes, it's possible. Our tests cost like £3, more or less, £3 to £5, and we are working right now in some tests that will cost like £1.
Okay, so thank you so much, Marcus. Congratulations for your presentation, your pitch, your question. The question from the judge was amazing. So really thank you and congratulations for being here. With that, I would like to invite the next competitor here. It's going to be the company Healthmap. So Healthmap is on the category of the disease management solution. So please, Paulo Dubain, okay. Nice to meet you. When you want, please start. I will start counting when you start talking, okay?
Okay, thank you. It's a pleasure to participate. Good morning. My name is Paulo Dubain. I'm the founder of Healthmap. That's a solution that was created to enhance the care coordination. When I was chief medical officer in some companies, we have a big problem with to have a solution that could be parameterizable for any kind of the patient, from a pregnancy to elder care. So we decided to create a solution that could be easily customized and put together the patient with the healthcare team, because at 2013, when you designed the Healthmap, the smartphone became too very common in Brazil. The solution permits to do a health risk assessment and create a care plan that measures the health risk, and they put the actions that the patient have to do, or the health team have to remember the patient to do. We have electronic medical record that are used in primary care units. We have to gamification. The platform permits that the client and the health professional engage with your healthcare plan. And you have a solution for health analytics that shows reports and dashboards. The patient journey, we have a solution for using for smartphone, but we have the solution to the web for the patient and the web for the professional. You developed into a telemedicine technology that was used first by the psychologist, but with the pandemic, the physician was permitted to use in Brazil telemedicine, so we increase a lot of the use of the solution because the COVID in the last years. We decide to be a Ruby. We have lots of APIs that integrate with many solutions. Example, the glycosimeter from Roche. You have the integration with BMJ to increase the help the physician to the clinical decision. And you have integrates with other solutions, a Brazilian solution that create an ecosystem integrator of healthcare. We have focus on safety. you use the cloud computer of Amazon Web Services, and you have now some new solution like facial recognition, and we are totally adherent to LGPD. We are present in 13 states in Brazil with a multilingual platform, helping to take care of more 2 million of lives. In some cases, the first case is about a health organization that reduce costs with fees, materials, and exam, using the platform to make integrate healthcare. The second case is about to use the platform and provide of mental health that could to make that patient have 89% of the care plan perfect, that make all the visits and use for psychoeducation. 74% of the clients use the platform very good to make your therapy, and this company make a return of investment about 72%. The third case is about a program of pregnancy that some humans decide to address the use of platform and others not, and you could contact too. And the difference of more 20%, the human that use platform 74% of adherence, and 55% in the human that don't use the platform. Thanks.
Sorry to interrupt you.
No
Thank
problem.
you so much. Thank you. So with that, thank you for finishing. I would like to invite the judge to the stage so we can have their questions, their 4-minute questions here for you. So anyone, just raise your hand, open your mic, and go on.
Oh, okay. Well,
okay, Nev. You first.
Sorry. It's like being on a quick draw set, isn't it? Really enjoyed that presentation. I think there's a real challenge with this type of technology and integrating it into all of the bits of the healthcare system that it will need to be integrated into to get the return back on it as well. So I think if you are interested in coming to the UK market, that will be the challenge as well. But it kind of feels from today that Brazil is similar to the UK. It's a fractured service. So in essence, it feels like you've dealt with some of those challenges in your market. So I think mirroring that in our market, mirroring the data governance standards in the UK market, the regulatory standards that you'll need to adhere to, and the APIs, the FHIR standards that will be required to do the integration are absolute must-dos if you're coming to this market. So a lot of work to do. Really like what you're doing. There's competition in this space in the UK. I think maybe it's because of the fractured markets we both exist in. So there is quite a bit of competition, but I think this would sit well, I think, with some of the desire in the system at the minute around the pandemic to keep people out of hospital and to make better use of healthcare resources in situ at home. So thank you. I'll enjoy that.
Okay, nice. Thank you.
Paulo, congratulations for the presentation, for your job. As Nev said, the connection with all the players or the actors of the systems is very important. Your clients now in Brazil, who are they? They are clinics, hospitals, and public or private?
Usually, our clients are clinics, and it's our focus at primary care. So it's outpatients units, but most of our clients are operadoras de plano de saúde, healthcare insurance company.
Okay. Thank you.
Welcome.
Okay. If we don't have any more questions, we can return. Okay, go ahead, Nev.
Okay, thank you.
You're on mute, Nev. Sorry.
I generally always have another question, Bruno. Apologies, but what's the business case here as well? So what are the cost savings that you are making in percentage terms or in real terms in the market you're in now? So you sell the service as a service offering. what is that return on investment to the purchaser, and over what length of time do we see that as well?
The return of investment for the client that use the platform?
For the patients, to the patients and the payer.
No, the patient don't pay anything, because usually the company use this is a solution that some service was created to sell direct to the patient. We provide solution for new business too. Example, there is a client that create a solution for mental health that sells for direct for the patient, use the out solution. So we are a software company.
Okay.
Okay.
Yeah.
Okay, we have space for one more question if any of the judges want. We have 10 seconds, but we can take more. Are we okay? Okay, so thank you, Paulo.
Okay.
Amazing.
Thank you,
Congratulations. Congratulations. With that, I'd like to invite the next one. The next one is Hhelp. Hhelp. It's a early detection and an accelerated diagnosis company. Welcome, Rafaela. Congratulations for being here. So you'll have 4 minutes after you start. I will count and send you a message here in the private chat.
Okay, thank you. Can you see my screen?
Right now, yes.
But okay, wait. Can you see in presentation mode?
Yes.
Okay.
Go ahead.
My name is Rafaela, and I'm representing Hhelp Health today, a Brazilian startup specialized in technology-based solutions and products for patients on cancer treatment and oncologist professionals. According to INCA, the National Institute of Cancer, Brazil registered 232,000 deaths from cancer in Brazil in 2019, and 625,000 new cases of cancer in Brazil 2020. Our mission is to be hand in hand with patients on the journey to fight cancer. Uniting technology and care, we developed a platform specializing in assistance in the treatment of cancer patients. We provide a qualified ecosystem with professionals that are able to meet the patient's demands through artificial intelligence. How does Hhelp works? We have 4 brands: a telemedicine appointments, a social action, a primary care, and our data science. How do we help the doctor? We promote practice, we increase medical appointments, telemedicine appointments, we manage medical records and prescriptions, we improve the digital presence, all in a pocket office. How does it work? The patient schedules an appointment in the app, and the professional performs the appointment in the app. Our social action. Because we're concerned about the social aspect, we developed in April 2020 Dr. Presente, an artificial intelligence to help on the containment of COVID-19. We're the first and only social artificial intelligence in Brazil. So this is our team of doctors that volunteer, and those companies are the companies that sponsored us during the Dr. Presente. The chatbot is present on WhatsApp and has already helped directly more than 7,000 people. It has a network of 50 volunteers and has reached the entire national territory. We also designed a BI to support the COVID telemedicine initiative. We provided public health personnel the data such as gender, age, color, region to quick identify places and demographics of most need. And the main goal is to display the availability in hours and by day of the week and time of the day to help to identify gaps, which can be using public health administrators to find professionals to fill specific day and time slots. Technology to assist the primary care in Brazil. How does it work nowadays? Breast cancer is the first leading cause of cancer death in women in Brazil. And according to the World Health Organization, extra procedures such as tracking cancer were suspended in 40% of the countries due to the prioritization of actions to prevent and contain COVID-19. How it works now in Brazil? We have a family health team that is responsible for 3,000 women. And they knock in 3,000 doors. They do all the procedures manually to register all their diseases or if they need of exams. Each team has only one nurse that is responsible for checking the data collected and schedule exams in the public system. The nurse needs to access the public system 3,000 times to obtain exam status. The nurse also needs to calculate by hand the need of further exams of 3,000 women. And she needs to notify every single woman by phone and schedule the exams. So it's a very long process. Our solution is a web system that allows nurses to have access to all the data throughout technology. It's an online platform that automates the entire tracking process. We expand the coverage of the target population. We put together the data of all women, type of cancer, type of exam, dates, results, and we calculate if further exams need to take place. We send automatic messages notify the patients about the date of their exam, result, and prevention. And our product, our web system looks like the one here showing on the screen. Thank you so much.
Thank you, Rafaela. Thank you for your pitch and for matching the time. I would like to invite the judge to the stage so they can have the 4 minutes time question. So again, just raise your hand, open mic, and go ahead.
Okay, Rafaela, I'll have a go first. Good presentation, bang on time. The UK market is going to be, I think, a challenge. I mean, there's a breast screening program that exists in the UK. I'm not sure if a similar program exists in Brazil, but a lot of what you were talking about there, I think, already exists in that particular market. Not probably with as much polish as what you're presenting, but I think that would be a difficult market to get into. So I just wondered, have you got any other markets that you're going after? So, for example, ovarian cancer in women's health is not particularly well served by a screening program, as far as I'm aware, in the UK. And I just wondered, is your platform easy to translate onto another indication like that?
So right now we're only in Brazil, and yes, it's very easy to translate, to exchange to whatever you want. I think this is a new and in expansion market, and there's still place for new players to join. We have some initiatives, they're not common, like the research in IA and premature diagnosis. And we have a very good thing that is our BI. He's in Harvard, he's a Harvard professor, and he helps us to track all gender, color, race, and we can insert in any market that we would like to. It's a very easy thing to exchange.
Yeah, I think that's
because our main goal is to prevention. Like we strongly believe that prevention is the best medicine, because we believe that our solution is going to save lives.
No, I mean, I totally agree, and I applaud what you've done. And I'm very impressed with the presentation. I think in the market in the UK, I think that's what you're up against. You're up against a national screening program that dominates a lot of that particular part of that prevention part of the market, and I think the ability to work in other oncology areas might be another string to your bow to think about if you really want to come into the UK.
I think that is a very good opportunity, and that once we can understand your market, there's no going to be a problem for us to get inside the market, because all we do here in Brazil is we try to make the best technology to help, to assist in the prevention.
Yeah, that's clear.
Yes, Maria? Okay, go ahead.
So just to build on what Neville said, it might be worth mapping what services you provide against if you're interested in the UK market, mapping them against the national breast screening program. Because it's a national program, it might be tricky to duplicate what's already happening, but maybe look for where you might be creating a unique offer. So, for example, I don't know if they offer AI as part of the screening. I think the screening is age related in the UK. I'm not sure, but it might be worth looking into where you might fit uniquely to complement the national screening program.
Yeah, I strongly believe, like, I would love to explain like how it works. Our IA, our BI, it's impressive. It's impressive what we can do, but this demands much more time. But we can schedule another appointment if you like with our data scientist. So he explains to you all the BI and what we can do in the UK market, how we can track, how we can help the public health to cut costs and get the majority of the population in the prevention and help you guys in whatever you need. We're here to help.
Great.
Really helpful. I mean, I think one of the perversities of the UK system, one of the problems we have is innovations like, as you've described, Rafaela, one of the risks that we sometimes unnecessarily worry about is that you're going to increase the amount of work that the NHS is going to have to do, because we're going to be finding more patients at an earlier stage who require treatment. So I think, again, the value proposition side of this needs to be looked at as well, because actually that's the right approach, because if we treat more people earlier, we will save money in the long run. But again, that's another challenge that you'll have coming into the market as well. The smarter your solution, the better it is, the more work up front, but the long-term benefits, we really need to be able to describe them to make investment sensible and worthwhile. So yeah, thanks.
Rafaela, just a short question. Today you collected the data in Brazil, and where do you collect this data here to publish to put in your platform?
Montes Claros, we're in Minas. We're in the north of Minas Gerais. It's a city called Montes Claros. We have a cancer hospital that we work inside this cancer hospital with the telemedicine, and we do the prevention of the public health. We work together with the city secretariat.
Do you collect it directly from the prontuary of the hospital for the patient?
Yeah, exactly. Yeah, exactly.
And this for this area in Minas Gerais?
Yes.
Okay.
Okay, so we are out of time on the questions. Thank you so much, Rafaela, for your pitch, for your solution.
Thank you so much for having me here.
Thanks, really thanks. Thanks for the judge. I will just do a 2-3 minutes pause right now. Just probably some people are arriving in the event, and I would like just to highlight why we are here and what we're doing. So this is a competition that had an online application with relevant questions about the solution of each company that are presenting here today. And the idea is really today to refocus of the competition is looking for innovation. So how to enable personalized medicine approach in primary care and support prevention, early diagnosis, disease management, and of course, going to the well-being for the patients and for the ecosystem. The winners that are, today we are pitching the finalists. The winners today will have and receive a mission to the UK, where they will have a different workshop that they can attend with important players from the British market, like inside the medtech sector, like UCL Partners and Medlink. In addition, I think it's important that all this program here, they're leveraging the program and the startup business. We want them to go global. So we are scaling up companies. We want to get companies that are relevant in the ecosystem today and scale up them to other countries. All the judges here are evaluating the startups with 4 criteria. One is relevance and innovation of the solution to the primary care sector. Second one is maturity stage and the market feasibility. Third one is the product fit in the international market, of course. And fourth, of course, is the pitch presentation, how the entrepreneur, how the startup speaker are really communicating and bringing, all the passion, all the knowledge, and all the impact the startups are doing. Okay, so amazing partnerships being set up here. UK Gov, as well as Clínicas Brazil, so DIT, really interesting to see that. So with that, let me stop this pause. Let me invite the next startup to the stage today. Let's talk with Medlogic. So Medlogic is the next startup that we'll pitch here. We have Danielle here. Thank you, Danielle. Nice to meet you. Congratulations for being here.
Thank you. It's a really pleasure to be here. Thank you.
Great. So you have 4 minutes as I align it. 4 minutes pitch, 4 minutes present questions from the judge. When you start talking, I will start counting, and then I will start sending you here in the private warnings about your time. Okay. Good luck.
Okay. Hi, I'm Daniel, CEO of Medlogic. We are specialized in elderly healthcare. Our technology is based on scientific publications of Dr. Edgar Nunes. He is the official consultant for the Brazilian government and full professor of the Federal University of Minas Gerais. I'm an engineer with an MBA and also participate at an innovation program at Stanford University. We received many prizes, a nomination as top 50 startups that can shape the future of Latin America at the World Economic Forum. In a consortium, we collectively received around £1 million grant from the Innovate UK and Newton Fund together with Brazilian agencies. And due to this project, we already adapted our product to the GDPR. However, after the Brexit, we will need to achieve both the UKCA and the CA marking. The world is aging very fast. In the NHS long-term plan, for example, our solution can positively impact more than one indicator. And this problem is not specific for the UK. We will be 2 billion elderly at the next 30 years. And the frail elderly, who represents only 10% of the 60+ years old population, they represent almost half of the assistance costs. And it is clear, if old people are not the same, it is critical to classify the population based on clinical declines. We developed this scientifically validated tool that can classify the population accordingly to the frailty level and not just disease. It takes less than 10 minutes. It can be answered by the family, in person, online, or applied by the GP, at the nursing homes, or at the point of care. The second step used in Medlogic is to create a personalized care plan for each individual. Our platform will support the diagnosis based on validated protocol and AI support. Yet, the wrong medication is dangerous for elderlies. We evaluated the risk of each medication based on evidence accordingly to the frailty levels. In this hospital, we evaluated 4,000 elders every month with these tools. And we are expanding to São Paulo, and we will double this number at the next months. But now the world is still more severe due to the pandemic. In EU, half of the total deaths happened in the care homes, and there is a huge concentration of frail individuals in these institutions. During the pandemic, we created a project to support hundreds of care homes, integrating them to the primary and secondary care. We reduced the contamination and the mortality rate to very low levels. There will be an event tomorrow when agents from Canada will see how exactly we did it. We know the frail elders and the care homes are sometimes invisible to the society, but I guarantee if an opportunity was given to the Medlogic team, we will be there for these vulnerable people. Thank you.
Thank you so much, Daniel. I think because of some of your, I don't know if your computer, your source font of your presentation, I think we lost at the beginning some seconds of your presentation, but we heard you very well. So I will invite the judge here to any questions that probably could not be so clear during the presentation. So any you have the 4 minutes, please.
So Daniel, thanks for that. That was really good as well. I think you're right on the money in terms of international need. I think there's a lot of competition in the UK. We have the Electronic Frailty Index is in place in every primary care practice in England, which again is a robust scoring system. We also have medicines management software linked to primary care, prescribing, and I think we also have a system called Restore 2, which is used in a care home environment to help score patients and their care. So what we probably don't have is a system that brings it all together into one place, which is, I think, what you've described. So I think there is an interesting opportunity for you in the UK market, but I think in many respects there's a lot of competition there in a very tight market. price will be very important as well. And so I think, yeah, a lot of work to be done in the UK market to really get your flag in the sand, but it looks promising that bringing it all together.
Thank you very much, Nev, for your comments. Actually, we are aware that there are other tools available in the market, but we have a public research that compare all the frail scales available in the world, and our tools was classified as the between the top 4 frail screening tools in the world. And we have specific scientific based arguments to compare our proposition to the others. But you are totally true. The core value of our proposition is to put the primary care, secondary care, and care homes together. And this was very effective during the pandemic here in Brazil.
Thank you.
Daniel, congratulations and thank you for the presentation. Sorry, I can't understand well your business plan. What your idea? How your client, your main client, your goal in this project?
It's a basic software as a service platform, but we are aware that some hospitals, they want to keep all the data, and we have our on-premise offering. It's much more expensive, but it's available for example, we are incubated at Albert Einstein Hospital. They have a startup program called At Its View. And for them, they want to keep all the data in their own service. So we have an on-premise offering, but we are very cost-effective for care homes in a cloud solution.
Your idea is just to sell the software. That's the idea.
Exactly. We have a lot of things in the platform. We have also 100 of online training for the multidisciplinary team. And this is important, but the training part is in Portuguese yet. We need to translate to achieve other markets. But I think it's an important part of the solution. But everything is just a monthly fee, and you pay to use the solution.
Because it's very difficult to collect the data with the information of the elderly people inside the systems that you have now. I think just you have this or in the hospitals or in the clinics. You don't have this in the SUS, for example, in the data SUS.
No, not in the data source. We are scaling up right now. We closed the deal with the state of São Paulo. We will attend our first center, elderly specialized center in São Paulo. They attend about 3,000 elders a month. And but we are currently generating a lot of data here in Belo Horizonte at the clinical hospitals. And we have an official partnership with the universities and the hospital, so we can collect the data and use it through AI proposition.
Okay. Thank you.
Okay. If you have any other question, go ahead. If not, thank you, Daniel. Thank you, Medlogic, for your presentation and your explanation about your business. So with that, next one, we have 3 more startups invited for today. Next one will be WideMind. So WideMind, it's early detection and accelerated diagnosis startup. Place, who is going to be the presenter here, Marcelo. Hi, Marcelo. Nice to meet you.
Hi. Nice to meet you.
So as always, 4 minutes. When you start talking, I start counting, and I will be sending private message for you to warn you about your time. Okay? Thank you.
Okay. So the share screen. Okay, so I don't know why this is not working. Sorry, my share screen is not working. What should I do?
Yes, I think you are sharing the screen of your browser. You should share the screen of your presentation.
Oh, don't worry. I'm gonna let's see if I can solve that. Did it work?
Let's check. Yes, perfect.
Okay,
go ahead.
I'd like to start by saying that it's an honor to be here. UK has taken a stand to defend the world many times in history and serve us as an inspiration in these difficult times. If these were ordinary times, I would start this presentation by telling you that my name is Marcelo. I'm a medical doctor and an economist. Together with my business partner, Rodrigo, who is a PhD candidate in computational physics, we are co-founders of WideMind. Our company is dedicated to revolutionize the way we interpret and analyze lab exams and healthcare data. We are in the business of help detecting disease earlier at a very low cost and low friction. Before becoming a physician, I was an economist for more than 15 years. I have learned from finance that we have to use data to predict future events, not only to inform them. The challenge is that traditional medicine models face is that many of the significant signs of health issues are only detected when the patient is already sick. In medicine today, the golden standard is to inform patients about his diseases, and that is always very frustrating. We all have experienced this pain one way or another, the unpleasant surprise in doctors' offices. We are informed about our kidney tumor or that we have become diabetic based on the result of an exam, as if that condition has appeared overnight, like yesterday we were normal and today we are sick. But as I said earlier, we do not live in normal times, we live extraordinary times. As a primary care physician during the pandemic, I've been working in the front line against COVID-19. I've cared for more than 2,000 patients so far through more than 200 shifts. I also have done dozens of business meetings wearing scrubs because our startup has never been so relevant. We did all that because we refused to give up on hope and did not wish to hide or wait to be rescued back to our normal lives. We are determined to help building a better future to everyone. Our technology begins with the state-of-the-art of medical literature to build risk models that allow us to predict disease before they are actually detected in traditional methods, so we can assist health professionals with patient care and enable better returns on investments with preventive actions in primary care medicine. In 2020, we created a tool that suggests additional investigations conditions that can be used for free as an MVP online. In other words, we identify biological dissonance before they are actually considered diseases. Today, by integrating our prediction algorithm with partners via white label, we will reach 200,000 patients in the first semester of 2021 and expect to have more than 1 million patients monitored by the end of 2021. This enables us to have a recurring monthly income per patient as 5 pence and a cost of 1 penny per patient in a model of SaaS business to consumer. Our internationalization challenge is to fulfill requirements of international standards for data formats and APIs. From that, we will be able to connect our applications with other health systems through Smart Health IT and other platforms, so that any entity from government to health techs can partner with us and integrate our predictions technology into their systems to reduce preventable health expenditures and save lives at a very low cost. This is a picture of our MVP working. And this is the market fit I just told you. And this is the place where I have been working in COVID-19, trying to help communities here in Brazil. I'm sorry for data problems, I hope.
No, then that's okay. Thank you, Marcelo.
I have to run a little bit more than I'd like, but that's life, you know?
Yes, that's life.
That's life in the new normal.
Thank you so much. I would like to invite the judge to start asking questions for you. We have 4 minutes questions for the judge. Raise your hand and just come on. Yes, Maria, please start. Thank you.
Hello, really exciting. Can you tell me what you described detecting diseases earlier? Can you give examples of which ones?
Yes. in the original presentation, that's not only 4 minutes, of course, we use a case study. And doctors, if they don't show a case study, we are not happy. What we do is this. We have two fronts of work in our company. One is lab tests. In lab tests, what happened is that you receive, let's say, leukogram, and then you have a value of leukogram, and that's detection of infection. And then you have like a you have to be inside an interval. If it's lower or it's higher, then the doctor goes and do some more investigation. That can be as simple as ask if your urinary tract is itching when you pee, or as complex as saying that you need a very expensive image exam. What happened is when you work with medicine like that, you only see diseases if you're already sick, because you have to be out of the threshold. And that's not at all as disease works. They work every day in a biological condition, so it's a continual thing. What we did was to do that. We use big data to build a model, a multidimensional model of how you should be. So we don't use thresholds that are for everyone. We make it personalized to you. So two people can have the same exam and very different needs for further investigation. This allows us to predict diseases earlier. We have cases where we avoid chemotherapy. We saw tumors that were like 16 centimeters. We could detect it when 1 centimeter, and we can do that very cheap.
And so in terms of follow-up with individuals, would you suggest a yearly test? How frequently would someone come in for these?
Well, what we do is that we, to change health in Brazil, we needed to work. We are a poor country, so we need to work with very low friction. So we use data that are already available. What our company does is better software. We already have the data, so the costs have already been paid. With the existing data and big data, we can complete the data you don't have and make it multidimensional structures that can say, every time you do an exam, you can either use our technology via SaaS and then you can pay us, or as we keep working our technology and becomes, like said, a new golden standard for kidney disease, then everybody has to use our technology. And then we stop being SaaS and revenue share and become a transactional, and everybody can use this. So it's like when you go to a laboratory exam, why do you have only the information? Why don't you have the prediction? I don't know if I'm being clear. These ideas for us are very clear, and we know that destroy the concept of disease is the only way to predict disease. If you build artificial intelligence models that make the threshold the disease, you'll never predict them. You have to make dissonance. And then Marcos Carvalho from Brava said that, and he's trying to do the same thing, but one condition is that we have to work with dissonance, the biological dissonance, which means this is different than we would expect for a person, your age, your height, with your exams, and blah, blah, blah.
Marco and Nev, if you don't have any questions, we can switch for the next. Any questions?
Just quickly, as much an observation. So the magical solution of AI to cure everything all the time definitely needs some testing in the wild world. I think clinical safety by design is something you'll be asked about in the UK. So bias, AI driving bias. What happens if you miss something? I think data quality drives high quality data outputs. What do you do in an environment where data quality is a little bit hit and miss, which is everywhere?
Perfect. Yeah.
Those are all challenges I think you'll need to think about as you come into the UK.
Yeah, you're right. You're definitely right. We don't have all the answers. What we see is that we take a different approach to disease, approach that is much more like we work in financial market when we complete data and try to predict things. And at this first step of our company, that maybe will be a long time first step, we only want to suggest things. When I was in Johns Hopkins, what happens over there is that the super specialists already know that something is wrong before the exams show it. But we cannot afford to have them looking at the exams here in Brazil.
Yeah.
So we are trying to make systems that have some kind of intuition to just suggest further investigation, not to diagnose anyone.
Thanks, Marcelo. That's helpful. That's a good clarification. Thank you.
Thank you, Marcelo. Thank you so much. Congratulations for presentation and your answers. Thank you for the judge. So with that, let's go to the next one. We have two more. Next one will be SleepUp technology, health technology. It's for disease prevention. It's a platform for insomnia treatment and sleep monitoring. Renata, good to see you again.
Hello, it's a pleasure to be here. Hello, everyone. Hello, Bruno.
Hello. So 4 minutes you have for your pitch. I will start counting when you start presenting your screen, okay? And congratulations, and again, good luck.
Thank you. Just, is it okay? Can everyone see now? Can you see the screen? Yeah?
Yes, perfect. You can start.
Perfect. Okay, let's go. So SleepUp is a startup that offers science-driven digital therapeutics for insomnia. Our purpose is to democratize the treatment and prevention of insomnia. We were born to help millions of people looking for a natural, effective, and accessible way to treat and prevent insomnia. And our vision is to provide personalized digital therapeutics for chronic diseases using wearable and AI. In UK, the number of people with insomnia rose from 1 in 6 to 1 in 4 after the pandemic. And insomnia is one of the most searched words in Google. Another problem is the sleeping pill addiction. Before the pandemic, this was a big problem. After the pandemic, it became even worse. So NHS doctors and doctors around the world are over-prescribing sleeping pills. So this is becoming a big problem. Another problem is the fact that 30% of people are not happy with current treatments of insomnia. 50% of them look for new alternatives, a new solution for that. We can see that in the graph. And the golden standard for treatment of insomnia is psychotherapy, is cognitive behavioral therapy. This is recommended by institutions and experts all over the world, but access is limited, mainly in primary care. So this is very specialized, so it's very difficult and expensive to find a way to have this therapy. So the problems we solve are the dependency, the side effects of pills, the low access to insomnia care, the poor lifestyle and habits, and the poor efficacy of current treatments, mainly the pharmacological treatments. And our solution is a digital therapy, an app that provides personalized digital therapy based on wearables and AI. So we capture qualitative and quantitative information from wearables and from clinical tests and sleep diary, and we personalize the journey in the therapy. We are developing our headband for EEG monitoring as well. And the benefit we bring for users is the non-medication approach, the easy access, it's digital, it's home care, it's personalized, so improve the journey, the engagement, and the efficacy, because we treat the cause of insomnia with this therapy. And the benefits we bring for health providers is the prevention of chronic diseases, the costs associated with insomnia treatment, hospitalizations, and chronic disease as well. We can help with home care treatment. We do not replace the polysomnography, but we can do prevent and help a lot with that. We have a lot of relationship between insomnia and chronic diseases. And for example, people that sleep less than 6 hours are 13% more likely to die. So very, very important statistics. And this is our product. We bring a lot of education and relaxation functionalities to support therapy. We bring assessment with sleep diary and 9 clinical tests and reports. We provide personal care from a virtual assistant up to telemedicine. And we have therapeutic modules, not just the CBTI, but mindfulness as well, and childhood, menopause, pregnancy, depression. We understand that that's very important to address these specific sleep issues. And this is our timeline. I lived 4 years in England. I did my PhD in Global MBA in Manchester, and there I identified this opportunity. We then started our journey in the Brazilian ecosystem with Founder Institute, Distrito. We were selected for Samsung Acceleration for governmental funding. We launched our app in the Play Store already, the first version. We filed our brand in US. We're launching our first version in US as well. And we are incubated in the most innovative private hospital in Brazil, Albert Einstein. And the next steps are the clinical trials, regulation, and fundraising. And that's up to a little bit more than 1 year of startups. We are early stage, but we have a lot of success to share. And this is our team. I'm CEO, and we have a complementary team. Thank you very much.
Thank you. Sorry to interrupt you. We want to be very strict to the time. So thank you. Congratulations for your presentation. I think you were a little bit almost on time. So let me invite the 4 judges here, 3 judges here to start questions. Nev, Maria, and Marco, please just raise your hand and just start.
Okay, I'll dive in again. So really like this, Renata. It's a big challenge. There's a lot of competition in this space, particularly in the UK. So I think really thinking about what your USP is for your product against other products in the market. I think SleepUp, you're probably aware of, is probably the dominant product in the market in the UK and in other markets as well. So I think really thinking where you're going to differentiate there as well will be really important. I think regulation, digital, safety, digital data, how you handle it, all of that stuff, really, really important. If this has origins in the UK, you've probably ticked some of those boxes, but there is definite appetite for this in the market, and I think competition between good products will go down well on the market. It's tough here, but I think this is a product that would have a real opportunity. I liked it. Yeah, it's good.
Thank you. I'm happy to hear that. Yes, we know all the competition. We know the differentiation that we bring, and I think we can learn a lot from the NHS with a lot of the initiatives of online CBT and the competition that you mentioned, and the regulatory, of course.
Go ahead, Marco. Sorry, you are on mute, Marco.
Sorry, sorry. As Nev said, you probably have a lot of competitors in your business, in your project. But I test by myself a lot of these problems B2C, and I like of them. But there is a problem that I saw in most of them, when the patient or the client need to put a lot of information in the app or kinds like that, or types of information like that. In your project, you have a wearable and a device. You need more information from the client, or you can get all the information with the device or the other things that.
It's a good question. We capture actually not just biometric information, we capture a lot of clinical information. We have 9 clinical tests from mental health up to chronotype. So we can really have a big picture, clinical picture of the user, of the patient, to be able to understand the best, to design the best journey of therapy for the patient. So the headband is very important for the EEG capturing, for the staging of sleep. This is not possible with any other type of technology apart from the polysonography. All the devices currently available, they do not capture with precision. So this is one differentiation that we bring. And the other differentiation is the fact that, yes, the user do need to input more information for us to be able to understand clinical conditions, mental illness, other mental illness, other sleep disturbances, apnea, and so we have to. It's a treatment. It's a protocol, really. That has to be. It's a journey.
Do you need an adherence of the patients? No? That's the idea.
Definitely, and that's one of the challenges: the engagement, the adherence, and that's why we have a strategy to bring a lot of to bring the virtual assistant, the telemedicine, the mindfulness, and meditation. All of this complement therapy and attract the user to carry on. And the personalization, that's the most important thing we bring. And that's what patients and users want. They want something to be predictive, to be relevant, to be assertive. They need personalization of the therapy. So just conventional CBTI protocol doesn't solve the problem of pregnancy women, of shift workers. So we bring all of this into the therapy.
Thank you.
Thank you, Renata. Of our time, we have the last startup to present. Congratulations for your presentation and your questions and answers here. Good luck. So with that, let's invite the last startup to come to the stage. I would like to invite Pedro, my friend Pedro, to present here EpHealth Primary Care Solution. Good to see you here, Pedro. Congratulations for being here.
Hello, Bruno. Good to see you again. Can you see my screen already?
Not yet. Let's just wait for. Yes, now we can see your presentation in presentation mode. So I will start counting for minutes when you start talking. Okay. Thank you.
Okay. Thank you. So hello everyone. I'm Pedro, CEO and co-founder of EpHealth. It's a pleasure to be here. And for us, proactive care begins today. More than ever, healthcare is now priority. The global healthcare spending is projected to double for the next decades. And things are changing fast. A new approach to healthcare is emerging. This is primary healthcare, and we call here as proactive care. Instead of only looking into hospital, fragmented disease, and being more expensive, we are now focusing more on people, integrated health in a much more affordable way. And we believe that large scale matters. We cannot talk about primary care, proactive care, if we still have limited access to health, only available to a small amount of people. And for this reason, our current reach is already 4 million people. Our impact is from end to end in primary care. We have the platform for cities, healthcare professionals. We have the social integrating with healthcare workers on the field. We have scientific development, and we are connecting people. Our proactive platform is already implemented in more than 50 municipalities of Brazil, and we are helping to manage the health workforce on the field. We are digitalizing the whole primary care settings, and we are, of course, controlling population's health at scale with over 30 health conditions like hypertension, diabetes, all the major chronic diseases, pregnancy, child health, elderly people. In the social area, we have developed this free app for health navigators that we call here health agents, community health workers, which are really important as a pre and post appointment, helping the GP, the primary healthcare physician, to be more efficient inside the clinic. We are already in over 3,000 cities, and they are performing over 500,000 home care visits a month with our solution. In partnership with research institutes, we are promoting large-scale research. We have a master agreement with the Academic Research Organization of Hospital Albert Einstein, and we are already conducting studies on COPD, heart failure, stroke, oncology, and cardiovascular diseases. And now we are about to launch the EP Connect, your data, your power, your impact. We are helping individuals to connect with their own health team to control their medicines, their vaccines, and all the basic information, and improving access to a much more affordable life insurance and microloans, because we cannot forget how important also the financial aspect is when we are talking about improving health access. We have recognition in all these areas that I've just mentioned, by the federal government of Brazil, by mainstream media. In the social area, we've been awarded by United Nations program, TEDx event. In the science area, we've been presenting EpHealth in the last 2 ESC Congress, the largest medical congress of Europe. We've been also awarded by the London Tech Week, Novartis, Basel area. And for EP Connect, we are now partnering with a really important global insurance company and a local bank in Brazil for microloans. Finally, despite all the growth and results that I just mentioned, we know that we're just getting started in our journey. And our 2030 vision is to become an impact unicorn. For us, mean not only a company that worth more than $1 billion, but most importantly, a company that positive impact more than 1 billion lives. Thank you very much.
Thank you, Pedro. I was waiting to be transferred to here. Congratulations, congratulations for being on time. Let me invite the three judges here to start asking the 4-minute questions for you. Please, Nev, Marco, and Maria, any questions you have for Pedro, you can start now.
So Pedro, I'll pile in again then. In terms of where do you see this impacting most? So where are the measurable benefits going to be for patients in particular? Where do you see the aggregated outputs and outcomes to be? And how are we going to measure them? Because you're attacking on quite a broad spectrum. So how are we going to be able to associate benefits to what you're doing?
Yes. First of all, we're talking about health access. It's really important, even to the most vulnerable people. We're talking about the rural areas, the rainforest area. How do we achieve them? Thinking not only the people who live in the big city, that's the major. After that, once we connect them to the health team, sometimes they're missing some like small things it's really important to them to make an appointment with the GP, to have access to their basic medicines for hypertension, diabetes. So first of all, we're talking about access to the service, to the medicines. In a long-term plan, of course, we aim to measure the health outcomes. Like once we digitalize the whole primary care settings, we will be able in a pretty soon future to measure how all these initiatives is impacting on the health outcomes. But we know it's not simple, it's a long journey, but we believe we are on the right track for that.
Thank you.
So just thinking
Go ahead, Maria.
Thinking of applicability to the UK, we have they're called different things in different areas, but community champions are being set up and they're being funded by the national NHS team at the moment. So it's something that's, I guess, in existence in the market in the UK. It would be helpful to look at how that's working. It works very differently in different areas. They are working closely with GPs to support people. Health inequalities is a big issue in the UK, and we have lots of people that don't go to primary care. So I guess thinking about what your unique selling point is, and if you've had strong successes in Brazil in drawing in and working with people that don't always access services, that might be something that unique that you bring. So think about how it compares to things that are already in the market in the UK, and think about what you can bring to it that's unique.
That definitely, and from our point of view, when we talk about UK, we're not only looking like London, the Covent Garden, and those kind of people. We're looking also, as you mentioned before, the Southwest, the South, the North, the Wales, the Scotland, the people in the rural areas, and how are they? How are those GPs technologies? Are they getting the right technology to access people, to connect those people at scale? So this is what we see in the UK market. Of course, we know all the NHS digital APIs that we need to connect, the NHS spine. We've been studying everything on this regard, but we do believe we have a strong potential for the technology itself, but also, of course, in all the scientific development that we're dealing with together with academic organization, big industry that are most basically in Europe and UK.
Thank you. We are out of time. Judges, thank you for your question. Thank you, Pedro, for your presentation. Amazing. So I think we are going to the end of our event today. The next steps will be all the judges will be now going to a private room to deliberate about the decision of who is going to be the 3 startups winners of the prize. And with that, I'd like to invite Daniela to say some words here. And really thanks for all the judges for your time. Amazing. Nev, Maria, Marco, you made this event more brilliant with your questions and interactions with the startup owners. So with that, Daniela, please, your time, your stage.
Thank you, Bruno. Thank you so much. So hello, everyone. My name is Daniela Matos. I'm part of the Inward Investment team here in Brazil, and I'm also the one that is leading together with a lot of group work, the Brazil Medtech Awards since last year. So first of all, I would like to say that I'm really, really happy to be here. It's a great pleasure. It's the first edition of Brazil Medtech Awards in Brazil. And I think that we have met some great challenges, but at the same time, we've met amazing companies. So thank you for all the companies that did their pitches today, but also thank you for all the companies that applied, all our colleagues, our partners that shared the opportunity. So thank you for spreading the word. I'm really happy. I hope you're feeling my happiness through this screen, but yeah, I'm really, really glad that we are here. So as Martin already mentioned in the beginning of our transmission, it's a really difficult moment worldwide. So I know you're all probably tired of being home. You're worried about your loved ones. We are waiting to get our shot of vaccines. And yeah, it's a really tough time. So, and I guess everyone is kind of tired of going to online events as well. So thank you for being here and thank you for taking the time to come to our pitch. But at the same time, we have opportunities. We have a moment that show how important it is to invest in science, how important it is to invest in innovation, in researchers, entrepreneurs, all the solutions that can not only solve our COVID situation, but also solve other problems. And I think this is what gives us hope, right? And the UK government is committed with this agenda of investing in entrepreneurs, in research, not only in life science, but all across all the areas. And I think this all was clear all along because the UK government has been doing this for a lot of time, but now it's clearer than ever. So we have the Oxford vaccine and all this great news on life sciences. And also talking about the British government being open for business and the UK being a great place to make business and to get your innovation to get spread out to the world, I would like to tell you quickly about how can we help the companies that want to internationalize. So we have within the British government here in Brazil, we have a program to help and support the companies, the Brazilian companies that want to go to the UK. So if you have a company or you know someone that have a company, and it can be from life science sector or any sector, and they are willing to go to the UK, we have a support for you. And why would you like to go to the UK? I think we are, Martin and all the companies and all the judges already mentioned some details about it, but the UK can be your window to the world. So it can be the place that you're going to access not only the UK market, that is a great market, and it will help you mature your solutions, to find new partners, find associations, but you can also go to the UK to become global, to access Europe, to access Asia, to access all the markets and mature your solution. So I think, I'm suspect to say that, but I think every business should be willing to go to the UK. Okay, so you're willing to go to the UK, but how can we help you? Our support is based on giving all the information and all the support we can so you can make decisions on your process of internationalization. So we will bring you information about the UK market on your sector. So if we're talking about life sciences sector or healthcare sector, what are the clusters in the UK? What associations can you get in touch with? What more bureaucratic details? So how much it costs to open a company in the UK? It's pretty, I will say to you that it's pretty easy. You can do that online and it's pretty cheap as well. But we can help you with that. How can you open your company? What the tax benefits are? How the tax system works? So salaries, all these details, we can help you. And I think one great characteristic about our work is that it's free of charge. So who doesn't love free of charge things? I do love them. So why not try to get our support if we are doing this free of charge? Is the UK government funding helping to make the Brazilian business go global and also to move the UK economy. So we are free of charge. Our support is free of charge. We also do a confidential support. So all your data is secure with us. And yeah, I think this is the first characteristic. But the second is, with this support, we can give you all this information to help you make the decisions you need. So for example, if you're a startup and you don't have a lot to invest in the first place, but you want to open your business in the UK because you're convinced it's important, you can come to us. We will make a tailor-made program for you. So our support is tailor-made. If you want to work on a co-working space, it's totally fine. If you want to build a fabric manufacturing plant, it's totally fine as well. We can help you. So we will put in contact with everyone you need. And yeah, I also wanted to mention that once the companies, they open in UK and they're already making success, we don't abandon them. So we're still with them, helping with our aftercare program. Our aftercare program is to work together with the companies once they are already established in the UK. So if they want to expand or if they're having any problems, and we are always having regular meetings with them and also promoting events in the UK for those companies to attend. Yeah, so I think my slogan, I was thinking about a slogan, is not official, okay, it's out of my mind, but my slogan would be that we can help companies internationalize by giving them information and guidance. And if we don't know the answer, we probably know somebody who does. We have a great team of specialists in UK and also in Brazil. So for example, sometimes the companies have some queries about tax benefits, for example, tax reliefs. So I'm in a sector or I'm doing this kind of research that I can get a tax relief, but I don't quite understand it. Can you put me in contact with a specialist that will help me? Yes, definitely, we do that. So if we don't know the answer, we know somebody that does, and we have a great network of specialists and people that can help, and local partners as well. So if you want to know more about Manchester, or if you want to know about the Nova Powerhouse, if you want to know about London, we have those partners as well. So we basically know a lot of people and this is how we can help you. So yeah, if your company is aiming to become global, contact our team and count on our support. And we have our email in the link description of the YouTube that we are transmitting now, but we also are putting them in the chat. So send us an email, we can schedule a chat so we can talk further about your company's reality. And yeah, so my time is almost over. So I would like just to thank a lot of people again. I know Martin did some of the thanking, but as I've been leading this project with a lot of people helping me, I would like to give a big thanks to a lot of people. So first of all, our partners. So this wouldn't be possible without you. Thank you for UCL partners, Madeline, Nice, Distrito and Innova HC, and all the ones that helped us spread the word and bring these amazing companies here to pitch for us today. I would also like to thank the companies that apply, and not only the ones that are here today. Of course, I love the pitches. They are amazing. But I would also like to thank the ones that were not selected, because it doesn't mean your solution is not amazing. We've seen many amazing solutions, and we will be open to help you as well with our support if you can. So thank you for believing in our competition. And also I'd like to thank a lot of people in our internal UK government staff that did amazing work. I can even describe how happy I am by the support we got. So Hhelp and Luciana from the mission in the UK, together with Linda, Ahi, William, and all that have made this possible. Sofia Ramos, who is no longer with us in DIT Brazil, but she was the one that started the project together with me. So thank you, Sofia. Cristiano, Julia, and Ricky, who are the amazing team of FDI in Brazil. Also Arlie, Danilo, and Juliana from the life science team in Brazil. They helped us a lot spreading the word. And thank you, Cristina Hori from the Science Innovation team, the Marcoms team for all the communication. Thank you very much. Martin for opening the session. I know your agenda is very busy, so we're really glad to have you here. Also, our judges today, Maria, Neville, and Marco, thank you very much. Also, Digitalks for helping us with the logistics. I wouldn't be able to do this transmission on my own. I think it's really difficult. So thank you for the logistical support. And also, finally, thank you, Bruno Pina. You've been a brilliant host. And yeah, we are having a lot of fun and knowing a lot of amazing companies. So yeah, you've done an amazing job. Thank you. And thank you, all of you that are watching. And with that, I give you the word back, Bruno. Thank you, and thank you for listening to me for a lot of minutes. I hope it was entertaining me at least. Thank you.
Thank you, Daniela. For me, and to be honest, it's definitely an honor for me to be invited to be here. I am, for the guys that know me, I am a guy that is passionate by this ecosystem of innovation in healthcare. I am fighting for fostering more entrepreneurs, because we have a huge ecosystem in healthcare, but we have also a huge problem in healthcare, not only in Brazil, but around the world. And we need serious people. We need passionate people that are trying to solve that, trying to hacking this healthcare ecosystem is what we need. So I think definitely this type of event and what you are offering, you all are offering, this is a pleasure for every company that had the opportunity to propose and to send their pitch to be evaluated. And what you were just describing about the benefits of being inside this program, this is payless. This is amazing. I think you are, of course, helping Brazilian entrepreneurs to becoming more relevant, and by helping them with UK partnership, you are also helping Brazil, because you're making the solutions to become more accurate, with more quality. So really good to see this. Really good to see such a type of innovation prize, and it's the first. So imagine the next. So really amazing, really amazing, and a huge team behind.
Yeah, thank you, Bruno. I totally agree. And I think, we have a lot of challenges, as you mentioned, not only here in Brazil, but worldwide. But I think it's about helping the companies to overcome the challenge, because the UK is really looking to the best solution. And I mean, if we have some challenges together as Brazilian companies or tech companies, we are definitely here to help. So it's my pleasure. I'm really excited. Thank you.
Great. No, very, very nice. So with that, I think it's the moment to start bringing the judge to the stage, if someone is here with us, and also starting to announce who are the winners. And to be so honest, I think remembering this prize was about bringing innovative solutions that can help on the enable personalized medicine approach for prevention, early diagnosis, and disease management between UK and Brazil. Partnership, as Daniela said, for UCL partners and Medlink. But it's really nice. With that, I think what I want to start calling here is who is the list of winners, let's say like that. So the first one, or not the first, but we are going from the third to the first. The third one will be EpHealth Primary Care Solutions. So I want to thank Pedro and all the team behind EpHealth for selected from the judge as very nice and mature solutions for being with us. So very congratulations to EpHealth. I don't know if Pedro is here with us, or if the judge want to do some comments. Is Pedro with us? I really don't know. Yes, Pedro, congratulations, my friend. So you are one of the selected to be part of this program.
Thanks, guys. Very happy with that. Thank you so much.
Yeah, if you want to say some words like an Oscar, you can thank your mother, your father, everyone.
Yeah, I'd like to thank the organization for making this happen, which is really important. We are actually looking for the UK, regardless this event, because we do believe it's one of the top, or definitely one of the top ecosystem in life science. So it's really important for us to validate in the NHS some kind of features of our technology, gathering with the academic science network. And of course, we want to become a global company. And for us, UK is the place to be if we want to become a global company. So thank you very much again.
Congratulations, Pedro. Very, very, very happy to see that. With that, the next winner, because it's 3 winners. There is no stage on that. But the next winner will be SleepUp technology for the solution for insomnia and sleep management. Let's say like that. So I don't know if Renata is here with us. If yes, if someone can take her to the stage, we can thank her. So yes, Renata is here. So Renata, if you want to say some words in this Oscar session, please.
Yes, I'm very happy. I'm very happy to. Hi, can you? Yeah, okay. Hi, I'm very happy. I'm really very happy to be selected. Even more to see that you all believe in our purpose to help people to improve sleep habits, to improve insomnia. This is a big issue of half of the population. So I'm really happy, and congratulations to all of you. I'm sure it will be an amazing mission in UK.
Yes, it's very exciting to see you all from Brazil to the world scaling up your solutions and becoming part of the UK ecosystem. As you all know, it's a huge, mature ecosystem that helps much more than 3,000 startups, but really can help us as a Brazilian country to know and to extend this knowledge. So I'm really happy for you and for Pedro as well. So the next one will be Hilab is the next winner. So we have 3 winners. Hilab is the 3rd winner as well to become part of this program in UK. I don't know if the Hilab guys are here with us. Probably yes, but someone is trying to grab Hilab from the feeds. Okay, so someone is calling them. Yes. Marcus, please take your stage on the Oscar and also say some words, please.
Okay. Okay, perfect. The YouTube was on. Thank you very much for the jurors for the award. We are extremely happy about that. I mean, we have been working pretty hard to try to create a global lab. We did a lot of things here in Brazil, but testing our technology in a place like UK with one of the best public services, health services in the world. It's something. It's like a dream for us. So thank you very much in the name of everybody here in Hilab. Thank you.
Yes, as a Brazilian citizen, I'm very happy to see. I know all of you 3 and what you're doing in the market. Very happy, really proud to see that. So with that, I want to give Maria and Marcos some space here to say some words, please.
Just to say it's well done, everyone. You can see how passionate you are and how hard you work, and really excited to see you in the UK. So well done, good luck, and you'll be brilliant. You don't even know. So well done.
Thank you, Marco.
Congratulations all of you. I'm very happy because, as Bruno said, the devices and the products are very good in my opinion. I think most of yours are right from the market, and right for the big market outside of the country. And for us, the Brazilian citizen, and for us that work in the ecosystem, to develop the ecosystem, to develop yours, I think is a prize too with yours. Congratulations and good luck in your next journey. Thanks so much.
Thank you, Marco. Guys, with that, we are finishing our almost 2.5 hours session today. I would like to thank it again for inviting me to be part of this program. I am a fan of what UK government is doing for Brazil. I really believe in the partnership that we are designing and how also as Clínicas and many others are working together with you. Really thank you, all the participants who was here until now, seeing this live transmission. Please stay connected to what the UK government is doing for Brazil. We are very proud of how this partnership between these two countries is becoming so huge. So really thank you so much. For me, it's my final pitch here. Goodbye, have a great nice weekend, and we have now a holiday week in Brazil. So thank you, bye.
Welcome to the United Kingdom, home to an automotive industry making cars for over 100 markets, and where some of the world's biggest movies are created. Welcome to the first testbed for 5G technologies, and where top pharmaceutical companies find their talent. Welcome to the largest offshore wind farms in the world. Welcome to a land alive with opportunity.